baby. Welcome to Heartbeat TV. We like to offer our condolences to the family of Colin Powell, a reluctant warrior, but a warrior nonetheless. And yes, you're right, Mob Radio. It seems like those significant people that's been with us so long will never leave us. But how untrue. Rest in peace, reluctant warrior.
Colin Powell, born April 5th, 1937, and left us October 18th, 2021. He was an American politician, a diplomat, and a four-star general who served as the 65th United States Secretary of State from 2001 to 2005. He was the first African American Secretary of State.
It has been reported that Colin Powell died from complications of CV-19, which is true, but he was also battling Parkinson and a cancer, a blood cancer. And how did this blood cancer affect Colin Powell's body ability to fight off CV-19? Let's get into the video.
Multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Healthy plasma cells help you fight infections by making antibodies that recognize and attack germs. In multiple myeloma, cancerous plasma cells accumulate in the bone marrow and crowd out the healthy blood cells. Rather than produce helpful antibodies, the cancer cells produce abnormal proteins that can cause complications. Signs and symptoms of multiple myeloma can vary, and early in the disease, there may be none. When signs and symptoms do occur, they can include bone pain, especially in your spine or chest, nausea, constipation, loss of appetite, mental fogginess or confusion, fatigue, frequent infections, weight loss, weakness or numbness in your legs, excessive thirst. When should you see a doctor? Make an appointment with your doctor if you have any persistent signs and symptoms that worry you. What causes multiple myeloma? It's not clear. Doctors know that myeloma begins with one abnormal plasma cell in your bone marrow, the soft blood-producing tissue that fills in the center of most of your bones. The abnormal cell multiplies rapidly. Because cancer cells don't mature and then die as normal cells do, they accumulate, eventually overwhelming the production of healthy cells. In the bone marrow, myeloma cells crowd out healthy blood cells, leading to fatigue and an inability to fight infections. The myeloma cells continue trying to produce antibodies as healthy plasma cells do, but the myeloma cells produce abnormal antibodies that the body can't use. Instead, the abnormal antibodies build up in the body and cause problems. Thank you for your service.
Thank you once again for stopping by. Remember, protect yours and check in on my Heartbeat TV.